Hey everyone, this is Dr. Sam McKinney coming to you live from Athladent's first YouTube video. Just a little bit of background about me. I am a dentist in northern Wisconsin who also really loves endurance sports. Cycling, to be exact. I also love cross-country skiing. I love ski touring. Not as much of a runner, but I'm slowly getting into it. You can see me with my lovely fiance up here in the upper left, Erica, and in the middle here, my buddy Jack, who we ride bikes all together, and also Jason and I. Down here on the left, you got me and a couple dental buddies out for a morning ride. My good buddy Mitch and I out for the cross-country ski race called the Berkey, and that's actually our first one there. See me after the Lutz 99er. Me down here with my good buddy Jack, who is also a dentist. Down here on the lower left, me outside of our Siren Dental Clinic. Just started up here at Siren Dental in the last 9 months or so. Absolutely loving it. And here it's me with the coffee at my desk from Erica. Very, very fun place to work. So I started this channel to discuss old and new studies to help increase the overall dental health of endurance athletes like cyclists, runners, triathletes, cross-country skiers, etc. Anyone else who kind of participates in that realm of hour-long sports and plus who have got dental disease. You can check out Athladent.com for oral care products. I actually have a line myself called Athladent. We are going to be launching here in about 10 weeks or so. Getting super excited for that. It's just a product that I made that is just formulated specifically for endurance athletes. So go check that out. I also have blog posts on my website talking about different topics such as beet juice and all these different things that you never really think about in the endurance world and kind of how they impact your overall oral health as an athlete. So to get into the main topic, what's the big problem? Well, athletes have a very specific problem, and it is a very, very well documented problem. So you can see here in this study right here, it's oral health and impact on performance of athletes participating in the London 2012 Olympic Games. It's a study that looks at 302 athletes from the 2012 Olympic Games, and it talks about how many athletes had dental caries, so cavities, how many had erosion, 45%, how many had periodontal disease, which 76% of athletes had gingivitis and 15% had periodontitis. And you can see here that more than 40% of athletes were bothered by their oral health, with 28% reporting impact on quality of life and 18% on training and performance. That is quite a large population, especially of elite athletes in the Olympic Games. Another study here talks about elite athletes' overall health, overall oral health, values, and related quality of life. Down here, I've kind of highlighted the main topic of it, but it shows that over half the participants, being 51.8%, present two or more pathological or functional findings. Periodontal disease, particularly gingivitis, and dental caries were two of the most common conditions affecting nearly half the athletes. Another study here talks about diet and dental caries in elite athletes in Ireland. And you can see here that in 88 athletes from 7 different sports, you can see that the prevalence of untreated dental caries was 90% at an individual level, which is quite a high number. Moving on, even just another study to kind of hammer that nail in. You can see here the effect of endurance training on dental erosion, caries, and saliva, that among athletes, a significant correlation was found between caries prevalence and the cumulative weekly training time, meaning the more that someone trains throughout the week, the more numbers that they rack up, the higher prevalence of cavities that they're going to have, or that there's a correlation shown to. So, what does this mean? It means that athletes are at a higher risk for dental disease than just the general population, which is kind of interesting because us as athletes like to consider ourselves taking better care of our bodies than the general population. But looking at oral health, you go, oh man, what is going on there? So Breaking that down a little bit, studies show a ranging percentage of prevalence of cavities. You can see anywhere from 47% to 90%. So we can kind of go back and forth on the numbers, but even on the low side, 47% is quite high. You can't disagree that the disease isn't there. And it seems as though it's a higher percentage than just the general population. And this is because of multiple factors. You can see here, athletes are always fueling with carbs, whether that be a glucose-based fueling system, a maltodextrin-based fueling system, fructose, sucrose, acid intake, right? When we drink electrolyte beverages or when we drink energy drinks when we're out on our big run or our big ride or just trying to stay hydrated throughout the day, we're taking in acidic drinks, which are ultimately wearing away at enamel and adjacent oral structures and oral tissues, causing damage. And then kind of the big one is dry mouth, right? You have dry mouth when you're exercising, and that's because of a couple things. One of the biggest things is what we call the sympathetic and parasympathetic nervous system, or your fight or flight or rest and digest systems. When you start exercising, you get into that fight or flight mode, right? You start running, your heart rate comes up, and what ends up happening is your body starts shunting blood to your muscles, and it shunts it away from other things, right? You don't need to digest your food while you're running. You don't have to pee while you're running for the most part. You know, when you're a couple miles in or biking, then you go, oh man, I kind of got to go. Different thing. But for the most part, when you are exercising, you get into that fight or flight mode and you're pulling blood flow away from certain organs. Some of those organs are your salivary glands. With that, what ends up happening is you have a decreased salivary flow because of it. Now, the parasympathetic system, on the other hand, is responsible for increasing saliva flow, but that is downregulated here. So you can see sympathetic nervous system upregulated, parasympathetic nervous system downregulated, ultimately leading to decreased salivary flow. Another kind of compounding factor onto that is the increased mouth breathing. So when you're just sitting here at rest, just breathing through your nose, everything's fine. Your mouth is closed, your salivary glands are working. But when you start exercising and moving around, what ends up happening is your body starts moving, you need more oxygen because your heart rate's increased, you're moving, and you start taking in more oxygen through your mouth, right? You start breathing through your mouth when you start getting winded. And what happens is that excess airflow over the teeth and adjacent oral structures ends up kind of drying it out. Now that paired with sympathetic nervous system upregulation can kind of be a detrimental factor. And then you add on constant fueling with carbs above that, you go, holy cow, we've got something here that is just a wonderful area for cavities to happen, for ulcers to happen, for tissue damage to happen. And we got to start thinking about ways that we can decrease some of these factors, or at least limit them as much as possible, so that we can have a little bit healthier of an oral cavity. So changes can be made in athletes' habits and oral care products to decrease the prevalence of dental disease. It is kind of the death by 1,000 cuts saying. All these different things working together end up causing all of this dental disease. If you can make these little marginal gains in your oral care habits, in your habits while you're running or you're on the bike, to just think about your teeth and your oral tissues a little bit more, it can go a really long ways. You think about it just kind of like training. There's not one end-all, be-all thing that you can just do and you become a pro-level athlete, right? And it's the same with your oral care. If it was just one easy thing, everyone would be doing it. No one would be having these problems, especially these Olympic-level athletes who have access to all these different training things. But what it ends up being is just making these small little changes, and over time being able to take care of your teeth in your gums and the surrounding oral tissue. So if you haven't already, go check out Athladent.com. I post blogs on there. We've got our Athladent toothpaste. Go read about it. Leave a review. Ask any questions that you want. We should be launching here in about the next 10 or so weeks. We're just finishing up some of our testing and our abrasiveness testing. And we look forward to sharing more studies that we find and helping out the oral health of endurance athletes. Until next time, thanks for watching.